At SCL Health, one of our opportunities is to really partner and collaborate with other organizations and with the communities that we serve. Our project in Butte, Montana is an example of this. Working with our colleagues and our collaborators across the city and the county, we're able to get people into permanent housing, provide them the health care and the social services support that they need, and really move them from homelessness to hope.
Homelessness in Butte is really such a complicated thing. There's not enough housing, there's not enough affordable housing.
Three main problems that our folks are facing. Poverty is certainly one of them. Addiction is another, and mental illness usually plays a part somewhere in that person's life.
What is at stake for the poor and vulnerable if no one helps is that really they don't get the support services they need. And in the environment when we live in, there's a lot of cold months out there. People can freeze to death if nobody's there to help them.
It's really hard to do when you don't have that Maslow's hierarchy of needs, the food, water, and shelter. It's really hard to run across town when you're paralyzed in a wheelchair on an icy roads.
Butte, like any other city in our country, is facing huge problems with homelessness. More and more people are losing their houses, they're falling on tough times. So we see a lot of issues within our community where people just do not have a place to go. One of the great things about working at St. James is that we are trying to do a lot of things for homeless people. One, on a daily basis, we provide food for homeless people. Second thing that we're really proud about is that we partner with Action Inc. to provide permanent supportive housing.
The poverty rate in Butte is higher than both the state of Montana average and the national average. 20% of people here live below the federal poverty line, and 25% of our children are living below the federal poverty line.
I'm Drea Jacka, and I've been here in Butte for 6 years. I had a spinal infection in my back, and I was taken to the emergency room. I was paralyzed from the waist down.
Without a support network, they're using systems in our community that are really quite expensive to keep using. What we know about this population is that when you house them permanently and you provide some support services around them, it is more dignified for the person.
We literally go out with peer support and wrap services around these people.
Action Inc. has turned everything around for me and saved my life. This is the first time I took advice from a friend that said, do exactly what they tell you to do instead of doing your own thing, because doing your own things hasn't got you very far. It's turned my whole life around. It's given me a new start. Like I'm in my own apartment, I'm gardening, I'm starting school back again. I can start volunteering in the community.
St. James is very proud of our mission in that we're here to help the poor and vulnerable. We take care of the whole body. Not only are we taking care of those people with their medical needs, but we take care of people outside of the walls of the hospital as well. You know, helping people cope with homelessness and help people cope with a lot of their social determinants that they have as well.
This for me is about humanity and every person being able to have a dignified, decent life. It doesn't matter the color of their skin, what country they came from, none of this matters. Every human being is loved and cared for here.